Greetings, colleagues. That was really a terrific video from the children of the world. I hope you've been able to view many of the truly excellent PMAC sessions over the past 3 days. The overarching theme this year is the world we want, actions for a sustainable, fairer, and healthier society. I'm Dr. Timothy Mastro, the Chief Science Officer at FHI 360. I've had the privilege of serving on the PMAC International Organizing Committee for the last 3 years and working with a wonderful group of colleagues to plan this important session today on pandemic preparedness and response, stopping the next outbreak before it becomes a pandemic. On 29 January, 2 years ago, I joined 1,000 colleagues in a hotel meeting room in Bangkok for PMAC 2020. A month earlier, a novel coronavirus had been identified in China, and the first case of COVID-19 in Thailand had been diagnosed just 16 days before the conference. The meeting went ahead with temperature scans and hand hygiene measures. Elbow bumps were done somewhat in jest, and masks were optional. There were no problems with the meeting. So fast forward. Despite the development of remarkably effective COVID-19 mRNA-based vaccines in less than a year, truly miraculous, after 2 years of unimaginable disruption and loss of life, today we join on a Zoom call because the risk of viral infection remains too great to convene an in-person meeting in Thailand or virtually anywhere else in the world. How did we get so much wrong in responding to this virus? And more importantly, how do we make sure this never happens again? During the next hour, with the experiences of COVID-19, we will hear from 4 global leaders on what they believe needs to be done to prevent the next inevitable infectious disease outbreak from becoming a pandemic. Panelists have been asked to identify enabling factors and likely barriers and to address specific action steps to achieve the goal of preventing another pandemic. I'd like to introduce our 4 panelists. You will find their biographies on the PMAC website for our session. First, Dr. John Nkengasong, Director of the Africa Centers for Disease Control and a global thought leader. Unfortunately, Dr. Nkengasong was called away on short notice and will not be joining us in person today. However, he made a video of his comments to share, and his Africa CDC colleague, Dr. Tajuddin Raji, will join our panel for the discussion. Dr. Raji has 20 years of experience in medicine and public health and is head of public health institutes and research at the Africa CDC. Next is Dr. Soumya Swaminathan, who was appointed in 2019 as the first chief scientist at the World Health Organization, Geneva. She has 30 years of experience in clinical care and research and translating research findings into impactful programs. We will then hear from Dr. Rick Bright, who is CEO of the Pandemic Prevention Institute at the Rockefeller Foundation. Prior to this role, he served as Deputy Assistant Secretary for Preparedness and Response and the Director of the Biomedical Advanced Research and Development Authority, BARDA, in the U.S. Department of Health and Human Services. And finally, Dr. Monica Puri, who is Global Policy Lead at the pharmaceutical company Roche in Switzerland. She's a medical doctor and a trained public health specialist from India with extensive experience implementing healthcare programs across several technical areas of medicine and public health. And now it's my real pleasure to introduce my friend and colleague, our moderator for today's panel, Professor Helen Rees. Executive Director of WITS RHI at the University of Witwatersrand, Johannesburg. Helen is an internationally renowned expert on HIV prevention, reproductive health, and vaccines, and is one of South Africa's best-known scientists. Helen, the floor is yours.
Thank you very much, Tim. This is probably one of the most, probably will be one of the most watched seminars that's coming out of the PMAC conference, because it is just so topical and there are so many challenges and so many unanswered questions. And if you think back, when we talk about pandemics, it wasn't that long ago where we might go and watch it in a sort of frightening movie, or we might have a board game called Pandemic, which there are. And it was something that we would remember from history. We would all have heard about 100 years ago that there was pandemic flu, but not really ever sort of thinking it's not going to happen, not in my lifetime. And that was despite the fact that in 2009, we had the H1N1 pandemic, and we were caught short then. We didn't have vaccines initially. And when we did have vaccines, the last continent to get them months too late was the African continent. And then we were caught short again with the Ebola outbreaks in West Africa. Not a pandemic, but the Ebola outbreaks made us realize that we were not ready to press a button to develop vaccines, to have clinical trials designed so that we could quickly go into the field, to have regulatory authorities ready to respond. And so after Ebola, we said, not again. We're going to be better prepared. And to some extent, we have been better prepared. There have been all sorts of initiatives that you're going to hear about here. And we've been better prepared with planning for vaccines, better prepared with the international health regulations, with countries' competencies. But again, not as well prepared as we should have been. And again, we've been caught short. We have 4 excellent panelists who are going to look at this issue from 4 different perspectives. And we will have a panel discussion after they have made their first inputs. So what will happen is that each of the panelists will make a brief input from their perspective, and then we'll then have panel discussions, and I will target some questions. We'll also see if there are any questions coming through on the chat, and Tim will be keeping an eye on that as well. So if you do have some questions, you can try and focus those as well. And there might be questions that more than one panelist wants to answer from the very differing perspectives. So it gives me great pleasure, although not in person, but virtually and on a video this time, to introduce Dr. John Nkengasong. And as we've heard, unfortunately, he's unable to be with us. But I will introduce John first of all, who is the head of the African CDC and soon to become the lead of the PEPFAR program. But he has done an extraordinary job as the head of Africa's CDC, and particularly as a leader during this very difficult time. And he has been a voice for the region, and a region that in many respects was left behind before the pandemic, and has certainly been left behind now. So with this, I'm going to ask the coordinator to please put on the video. And then we're delighted that we have Dr. Raji Tajuddin, Dr. Tajuddin Raji is going to be able to come in and actually then contribute to the conversation after the video. Please, if we could have the video.
Greetings from the Africa Centers for Disease Control and Prevention in Addis Ababa, Ethiopia. As you are aware, the Africa CDC, as it is commonly called, is a specialized technical institution of the African Union. There are a couple of lessons that we've learned from this pandemic, at least from the perspective from the region that I speak from. First of all, that the world is more connected than we thought we were. Secondly, that the vulnerabilities that we thought existed are more than actually it is. We've seen how countries in the developed global north and the less developed global south are all affected at the same time with this pandemic. And lastly, the inequalities and inequities that exist in global health are further than we thought they were. both at regional, national level, and global level. In terms of connectivity, just between January 20th and March 20th, 165 countries were affected by the COVID-19 virus. That is unprecedented. It shows how quickly a disease threat anywhere in the world can be a disease threat everywhere in the world. How do we address this? We have to recognize that global health security starts at national level. So global health security is national health security, it is regional health security, and it is global health security. And unless we begin to recognize the various levels of our health security, it will continue to be a challenge. Over the course of this pandemic, the region of Africa got organized and launched several initiatives. Some of those include the acquisition of vaccines, a vaccine strategy, a genomic network, the African Medicine Supply Platform, just to name a few. That shows the power of regionalism. It shows the power that a continent like Africa can take its own health security needs into its own hands and show leadership. It is this kind of leadership at regional level and national level that, if strengthened and supported, will feed into our global security agenda. I look forward to an exciting conversation during the course of this conference. Thank you.
Thank you very much. And we will obviously be expanding on the whole thought about regional positions. And I know that Dr. Soumya Swaminathan is going to also be talking about what WHO's thinking and contribution has been to develop not only its global role, but also regional roles as well. As we heard, Soumya is the Chief Scientific Officer at WHO, which was a new job when she took it on, newly created. And you don't know what you're missing until you have it. So we're delighted that we've got you there. And the importance of your role has probably never been so acutely emphasized as during this pandemic. So Soumya, please, over to you.
Yes, thank you very much, Helen, and thanks to the organizers. And it was an absolutely wonderful video made by the children that was played at the beginning, which really put so much responsibility on us today to do whatever we can to make the future better. So I want to focus my comments on what the WHO has been doing, and particularly focusing on the role of science. Throughout the pandemic, we have seen that it is science that brought us the solutions, but it was a lack of solidarity among countries that actually resulted in the inequitable access to those solutions, to those health products that we see today. We also saw the role that science played in countries' responses, and those countries and the leadership that depended on their scientists and their public health experts to give them advice and followed those, with transparent communication, did much better than where science was not followed. So a couple of things, I want to be very practical and pragmatic because here we're talking about solutions. The first is that there needs to be some kind of a global R&D coordination when it comes to pandemics and finding solutions for them. And the WHO took leadership early on. Helen mentioned the Ebola outbreak. So I think learning from previous experiences, the H1N1 pandemic and so on, the R&D blueprint to fight epidemics was set up. And what that did was very early in the pandemic, in February of 2020, we had the world's leading researchers come together in Geneva and develop a research roadmap that included the roadmap for diagnostics, vaccines, and therapeutics, but also looking at all the other aspects of research that are needed, including social and behavioral research into the public health response. And there was also a working group on ethics that was set up that's proved to be very helpful. Following on from that, we started working on target product profiles, on template protocols, on establishing the benchmarks. And all of those really help developers and innovators, because once you have a clear, globally agreed product profile, then you know exactly what needs to be developed. And I must say that the regulators have played a very important role. They came together and they tried to harmonize as much as possible the regulatory approval so that we don't waste time on those. There is a big role for the private sector here. And this is where I think we still need to find solutions on how, without the private sector, we cannot have these products mass produced in the billions that we need. But at the same time, when governments invest and provide large grants to the private sector, as was done by many countries, then there must be some provisions for equitable access to those products which are developed to a large extent using taxpayer funds. And I think that is something that we need to discuss further, as perhaps as we talk, the member states of WHO are going to negotiate some kind of a pandemic treaty or instrument. And I think this whole topic of R&D and how do we share resources, but how do we also share the benefits? Because data sharing is very important early in the pandemic and throughout, as we've seen. If we didn't have genetic sequences being shared, we wouldn't know where we are going and the new variants emerging. But at the same time, if researchers from all over the world are going to share data openly, rapidly, then they also expect that they will have the benefits that come out of that sharing. I want to say a word about COVAX, because that was set up as a solution to address these inequities which we had predicted, and it was an end-to-end solution. So CEPI, looking at R&D and investing in R&D. You had Gavi with its experience in vaccine procurement and distribution, WHO with its normative functions, and UNICEF. So the partnership coming together along with the private sector and other stakeholders to try to advance vaccine development and delivery. Unfortunately, and we can talk about that in the panel discussion, why I think it's been a success. 1 billion doses have been distributed through COVAX, but how could we have done even better? What were the roadblocks going ahead? And finally, I think looking ahead, it's very important that we build this regional capacity for manufacturing, because the reason that Africa has been left out to a large extent is because of its very little manufacturing capacity, whether it's vaccines or drugs. And therefore, looking forward, we're looking also at biomolecules like monoclonal antibodies to treat many kinds of diseases. The first mRNA tech transfer hub has been established in South Africa. This is a global hub, so it's going to train people from all over the world on mRNA technology. We need more such initiatives and also a large biomanufacturing training, workforce training initiative, because human resources, both to man the factories and new manufacturing sites that are being set up, but also on the regulatory sciences, on clinical research, on ethics, the entire ecosystem needs to be built and developed and strengthened further. Thanks, Helen.
Thank you. So a huge amount to think about and to discuss once we move into the discussion. Very, very importantly, in response to the current pandemic, but also as we think forward, is the role of NGOs, of the not-for-profit sector, of philanthropic organizations, and not only with funding, but also their ability to have think tanks and to think in an innovative fashion. So it gives me great pleasure to introduce Dr. Rick Bright of the Rockefeller Foundation, where they are building a pandemic prevention institute, which is really quite novel and is asking some of the critical questions for the future. So Rick, over to you.
Thank you, Dr. Rees. It's a real pleasure to be part of this important discussion with such distinguished colleagues. It goes without saying that the last 2 years, the world has been dealt a traumatic blow. We will never truly be able to fully enumerate the full loss that we've seen in terms of public health and life and economic and education and society overall. And we all know that this pandemic will not be our last one and may not even be the worst one that we could face in the future. While we have learned some really hard lessons about how to contain and mitigate disease spread, each new variant from SARS-CoV-2 has reinforced a simple truth. We still remain unprepared. And Omicron is just the latest example, where we saw travel bans imposed without contact tracing, testing, and sequencing that show us gaps in our approach and how we respond. This does not work. It creates division and fear. It politicizes public health measures. It damages fragile economies, and it prevents global coordination and the building of trust, which is so critical for our response today and in the future. We need instead data-driven policies that we know will work to ensure the world is better coordinated, aware, and protected. The rapid sharing that we saw of data from South African scientists recently that made the early detection of Omicron possible should model how we move forward and share signals of disease threats. Despite the great challenges and the incalculable personal losses brought on by COVID-19, we now know what it takes to end this pandemic and build a future free of pandemics. That truly is a commitment to trust, collaboration, and rapid sharing of data. Over the past 7 months, we stood up the Pandemic Prevention Institute at the Rockefeller Foundation. Working with our global partners, we have made great strides in many areas. Together, we have increased genomic surveillance of COVID-19 variants. We've monitored wastewater to alert communities to rising outbreaks, and we've established new platforms for sharing data rapidly. We're developing new tools also to analyze and combine non-traditional data like travel and consumer information securely and in a de-identified way through a federated system of sharing that enables autonomous entities to maintain control over their sensitive information. By tracking these data, we can provide insights and early warnings on emerging infectious disease threats. Data are critical to tracking and managing an outbreak, but if data are not shared rapidly, the value is limited and it prolongs the duration of the crisis. So we have partnered with GISAID, the largest community of scientists in the world, that have shared more than 7.5 million genome sequences of SARS-CoV-2. Without this information, without this sharing among this community, the world would be completely blind still to this virus, its variants, and how they're spreading. I'm really grateful to each scientist, wherever you are in the world, for sharing your data for the greater global good of ending this pandemic and saving lives. And each of these efforts gets us closer to a pandemic-free world. And we must do everything within our power to make sure that we can say never again and make sure it doesn't happen again. And I firmly believe this is possible. However, our success relies on political will and effective collaboration with multilateral organizations and leadership groups, such as the World Health Organization and the World Health Organization's newly formed Hub for Pandemic and Epidemic Intelligence, and also other collaborations across borders, across sectors, at national and regional levels, but most importantly at the local level, building a local knowledge economy to enable and empower scientists, public health officials, and individuals with information that they need to act early and play their part in protecting their families and their communities. It starts with us in this virtual room today and around the world. No one can do this alone. We must work together, play to our strengths, contribute to the overall whole, and create and sustain a global surveillance intelligence system that works for everyone and is not something held by only a few. This, I believe, is the foundation of a strengthened ecosystem that will allow us to see these signals, speed a response, and stop outbreaks as quickly as possible. By working together through collaboration, transparency, sharing, and trust, we can make every day the best day for all of us. Thank you.
Thank you very much. We'll obviously, the issue of data sharing is obviously one of the biggest challenges in the future. So we'll come back to that. Our fourth speaker on this panel is Dr. Monica Puri from Roche Private Sector, and she's the global policy head. Certainly, if you look at particularly something like vaccines, that's always at the forefront of people's minds, the private sector has played a huge role across the world in the rapid development of vaccines. But it hasn't been without the criticisms of saying, why are these vaccines not more freely available? Why are they so expensive? Why is the private sector not willing to play at an earlier stage, for example, with COVAX? But these are some of the things that we can talk about. But I'm going to ask Monica to give the private sector perspective. Please, Monica.
Thank you, Helen. And I'm so pleased to be here with such an illustrious panel. And I'm honored to be able to bring the perspective from the private sector and the role we can play within the global action on pandemic preparedness and response catalyzed by COVID-19. I was particularly struck by what Dr. Soumya had said regarding the importance of working collectively within and across countries, sectors, and communities. COVID-19 has shown what's possible with partnerships. Never before have partnerships come together so quickly to so much effect. We've seen how the pandemic has mobilized the political will to create governance and finance structures to prepare for new pandemic threats. And I passionately believe that we have to maintain the progress we have made in this pandemic in breaking down silos and working together. Not just between scientists and biotech companies, but also between regulators, health authorities, global health organizations like WHO and ACT-A and national governments. This means public-public, public-private, and even private-private partnerships. As someone who works for one of the biggest innovative pharmaceutical companies in the world, I have seen firsthand the expertise and resources we were able to marshal to develop multiple tests, deliver billions of them to people who needed them, and have adapted them to new variants as needed. We've also repurposed an arthritis drug for the treatment of COVID-19, as well securing another partnership to bring an additional treatment option to patients, the cocktail antibodies. This is the contribution of the company that I work for. More broadly, the biotech industry, as you all know, has transformed the course of the pandemic through the speed of vaccine development, with production going from 0 to 11.2 billion doses in little over a year. And beyond vaccines, 2021 saw more than 100 collaborations between companies to produce COVID-19 treatments. Looking forward, as pharmaceutical companies, we stand ready to play a role in evolving better, more dynamic, and responsive healthcare systems as well. We can build on these strong connections the biotech industry, regulatory agencies, and trade bodies have fostered during the pandemic to facilitate future innovation, prepare for future pandemic threats, as well as supporting continued access to life-saving products for current infectious diseases and non-communicable diseases. This is crucial because as an aspect of pandemic preparedness and response, we must remember that people living with non-communicable diseases and other infectious diseases such as HIV, AIDS are even more at risk of disease and death from today's COVID-19 and will most likely be disproportionately affected by the next pandemic. Beyond partnerships, a critical area of focus, as Rick has said, is the acceleration of use of health data in general that can support cost-effective delivery of high-quality care for patients. A key component of this is governance around data sharing, which can enable the sharing of pathogen data and the monitoring of potential outbreaks. This is essential for the pharmaceutical industry as well to be ready to rapidly develop tests and active ingredients that can detect and counteract these threats. As an industry, we want to move to a world where data and digitalization are standard practice to enable better care. We want to partner on international standards, modernize patient record systems, and address legitimate concerns about privacy and data security. This is particularly important if we consider the digital transformation of healthcare systems, which has accelerated even further via the pandemic, including the enforced recourse to offering health assistance remotely. In fact, going further, I think the greater use of digital health solutions during the pandemic can be further leveraged to reach vulnerable groups and reduce health inequalities. This is another example of where we can work together to improve patient care. As we've understood, true pandemic responsiveness also requires universal health coverage to help prevent healthcare system disruptions. Resilient healthcare systems ensure the effective management of outbreak-related issues without compromising services for the prevention, diagnosis, and treatment of health issues at the same time. And here too, the private sector should and does play a significant role. For many years, the industry has been collaborating with academia, NGOs, foundations, development organizations, and other sectors to achieve the Sustainable Development Goal by 2030, including working with partners to strengthen health systems and expand access to quality healthcare worldwide. Roche has taken a comprehensive approach to progress UHC by supporting resilience in healthcare systems, improving access to essential medicines, and supporting capacity building. To sum up, the global health architecture, including the private sector, has faced serious challenges and been forced to adapt as a result of the pandemic. We achieved so much together through these challenges, and we must continue to keep working together to ensure that governance and financial mechanisms for pandemic preparedness and response are resilient, robust, and better able to ensure health for all. Now it is time to build back better on the advances made in this difficult time together. Thank you.
Thank you very much, Monica. So what I'm going to do, first of all, is I'm going to pose a bit, I'm going to give you all one of the sticky questions first to have a go at. But then after that, I want to come back to all of you with one question, which is, from your perspective, and Sumia mentioned it, what is we're talking about a pandemic treaty. We're talking about an instrument into the future. How would you see that being shaped? But I'm going to come back to that, but I'm going to ask some specific questions to begin with. And I'm going to start with looking at the regional, and John Nkengasong talked in his brief video there about the power of regions. And I'd like to ask Dr. Tajuddin Raji. Tajuddin, we're talking about the power of regions, but in truth, the African region is struggling. We have weak health systems, weak surveillance, and at the same time that we've had the COVID pandemic, we've had measles outbreaks, we've had yellow fever outbreaks in our region, we've had Ebola outbreaks. What do you feel? Is it really possible to really sort of create something that is responsive in the African region, unless we actually do something to fix some of these fundamental challenges?
Thank you, Ellen. So let me join John to congratulate the organizers of this important conference, and also join him to send my sincere greetings to all panelists. Now, having said that, I think, Ellen, Africa CDC has demonstrated exactly what you have said, whether there is any way, we can come up with a system on the continent that can address the specific needs, of our region. For instance, before the pandemic, we knew that when it comes to workforce development on the continent, we are talking of something around 2 to 3 per thousand population, as against around 25 per thousand population in the global north and other parts of the world. We knew quite well that most of our member states do not have what we call the modern equipment, that is required to respond, to some of this pandemic and epidemic. In fact, at the outset of the pandemic, there were only 2 labs, only 2 countries in the entire continent of 55 member states, 1.2 billion people, that could carry out a test to diagnose the SARS-CoV-2. In fact, at the outset, we also knew that in some member states, they actually have more vice presidents than mechanical ventilators. So we knew that, and this explains why, right from outset, we believe in the power of collaboration, we believe in the power of coordination, and we're able to leverage the unique position of the African Union, to support all our member states, irrespective of the ability to finance some of these, response mechanisms or not. For instance, just a week into the pandemic, the African Union were able to call all the ministers of health just a week when the first case was discovered on the continent. And in that particular meeting, we were able to come up with a continental strategy, which has shaped the way we have moved forward in terms of responding to the COVID-19 pandemic on the continent. We're able to put in place a lot of mechanisms, for instance, the African Medical Supply Platform, that allow for pool procurement, that was able to allow access of our member states, irrespective of their ability to pay, to have access to some of those health security commodities, like the tests, like the PPEs, like some of the therapeutics, including something as basic as dexamethasone. So we're able to use that platform to drive that. And don't also forget that the political structure of the African Union has allowed the African CDC to brief the head of state and government up to 16 different times. So meaning that whatever we have done, we are going to secure political support, and at the end of the day, with the support of our politicians, the head of state and government, the ministerial committee, we have launched what we call the new public health order, which has clearly articulated most of what the previous speakers have talked about. One, the need to strengthen our public health institutions on the continent, including the national level institutions like National Public Health Institute, the need to strengthen public health workforce development, the need to strengthen our local manufacturing capacities like vaccines, therapeutics, diagnostics, and Sumia clearly articulated what WHO is doing on the continent to regionalize some of these approaches. And as African Union, we have continued to work with all these partners. And the last but not the least there is for us to continue to leverage on the resources at the disposal of our private sectors. Monica has clearly talked about this. We have seen support coming from some of our tech giants. We have seen support coming from MasterCard Foundation. And with all this, using a regional and coordinated approach, I think we have been able to move forward. So going back to your question again, anyways, is possible and is doable. And Africa CDC has demonstrated that. Over.
Thank you very much. So you're right, it's demonstrated. I think what we're all hoping about is that we can keep this momentum going. Hopefully when we see the pandemic being reduced to something that is probably going to be an endemic outbreak instead. But let me move on to Sumia. And you mentioned the importance of solidarity, but what we've actually seen is a lot of nationalism, and we've seen Dr. Tedros really talking about this a lot, vaccine nationalism and so on. And we've also seen the politicization of the pandemic in some of the attacks, for example, that have been made on WHO, from which does it depend on which side you sit, but it's come from all sides. So how do you feel for WHO? How can WHO grow? It is the most important global health institution that we have worldwide. It does have global recognition. It has been underfunded and under-resourced. But how does WHO going forward start to tackle some of these challenges that we've seen sort of coming out of the woodwork in the course of the pandemic?
Thank you, Helen. I think you've got to the real heart of the problem, is that unless we have a global agency, we have WHO, which needs to be empowered, it needs to be funded better, it needs to be then accountable. But it can only do that if it has the funding and the powers that member states would like it to have. And then we need the member states, the 194 member states of WHO, to agree on a path or to agree on a framework that will be followed in the event of emergencies, whether they be epidemics or they be pandemics. And I think many of the speakers have said the kind of globalized world that we live in today, it takes only a few hours for pathogens to go around the world. So this is why nationalism is not going to help. It's not going to work. And whether it's vaccine nationalism or whether it's travel bans that are really not based on science, what we need is a set of rules or a playbook that everybody agrees to. And I must mention here again the role of the private sector. So it's not just governments, but also private sector and civil society, who should come together and engage, I think, and we have this opportunity now that there is an intergovernmental negotiating body that's been set up to come up with a draft pandemic treaty or convention. I think many of the things we're talking about today, from data sharing principles, Rick mentioned GISAID, which has been very successful, but it only handles 3 pathogens, influenza, RSV, and SARS-CoV-2 now, but they were able to very quickly set up the platform, and today we have 7.5 million genomes. But we need this for many other pathogens. And so what we need is an agreement on data sharing principles, which will then enable the setting up of platforms that follow those principles. And Monica mentioned how important it is for the private sector to also have access as rapidly as possible to this data. So it's going to help everyone. Rapid and timely data sharing is very important. But then we come to the question of what happens when you have developed the product and then it's either unaffordable or inaccessible. And we do need to find a solution for that. There have been some examples during this pandemic, the ACT Accelerator, with different agencies coming together and playing a role in procurement and distribution. We need to think about whether something like that should be established for the future, very rapidly coming together, or there should be separate agency. And then there needs to be the financing. And again, that's being discussed, how such a fund could be set up so that very rapidly. I mean, I think one of the things that COVAX faced initially was we had to go and fundraise to actually then go and put the orders for the vaccines, whereas all the high-income countries had already placed billions of dollars worth of orders to the companies. So naturally, the companies were prioritizing the countries that had put the advanced purchase agreements in place, and COVAX went a little bit behind in the queue. So we need upfront the funds to both boost R&D and to procure. And so there are many of these elements that will need to be discussed and agreed. So it's around governance, around which is WHO, how to strengthen, around financing, and then the systems and tools that will be needed to handle future pandemics.
Thank you. And let me then go on to Rick, because Sumya's mentioned the issue of data sharing. And this is really part of the core of what you've outlined the Pandemic Prevention Institute is really dealing with. But Rick, we've already seen that there's a lot, once again, of tension about data sharing, a lot of mistrust. A lot of reluctance in some cases to share. How is Rockefeller? Is Rockefeller well placed as a non-state party to address this, and how are you trying to address this particularly with countries?
Yeah, and thank you for that question, Helen. It's very important to recognize that the secret weapon to any outbreak or pandemic that we've had in the past, we've experienced, is data, or the data that we can get and the data that we can share. Those data inform us of an outbreak, how a pathogen, how it's changing, where it's going. Those data inform us when we need to update or make new vaccines or diagnostics or therapeutics. And those data inform us of where the hotspots are, so we know where to surge resources. Unfortunately, we've seen a lot of nationalism and hoarding of data. We've seen a reluctance to share, as you said, and a certain huge gap in transparency. And we've also seen, though, Helen, that there are many places around the world that just don't have the capacity to generate data. And when they have the capacity to generate data, they don't have the capacity to analyze it or to share it. So it's not an intentional reluctance. It is it's an inability to analyze and share it. A lot of the data that have been shared has been centralized in a few countries or a few spaces and a few entities. And the focus hasn't been as much on addressing those dark spots, those places around the world that don't have that capacity, and building that training and building that local knowledge so everyone around the world, wherever you are, can collect data, analyze it, and share it. So one of the things that we're doing at the Rockefeller Foundation to work with not just with countries, but with global entities, with leaders like WHO the UK government in the radar system, the US government in their CDC, and with the Africa CDC, and with partners in India and in Latin America and South America, and South Africa, that's connecting countries across Africa, is identifying the spaces where we have these data gaps. And we're working with other philanthropies such as the Gates Foundation, Wellcome Trust, Skoll Foundation, and they are helping to build capacity for additional data around the world. And what we're doing at the Rockefeller Foundation with our Pandemic Prevention Institute is finding ways to connect those data, to link together the different data generators and help build that local knowledge capacity to analyze those data, and then to connect those data into more of a global, centralized, but federated approach of analyzing those data as quickly as possible. And so we believe also that it's not just genomic data, it's not just a sequence from a nose swab or a blood draw that are critical to help us understand what's happening, what's emerging, or where something is going. It's important to combine new data types. If it's genomic data from environmental sampling, such as wastewater or sewage systems, in places that don't have a high ratio of patient to clinician to collect those nose swabs, bringing in that wastewater data or sewage system data and air sampling data is really important. Bringing in data about climate and about famine and about forest deforestation or fires. Combining all of those data, we believe, will give us smarter insights to let us know where we have a higher potential for spillover, and looking at a One Health approach and combining what we're learning from the animal world to the human world, and looking for those interfaces where we should increase our data monitoring capabilities so we can know when something has happened earlier. We believe the earlier we know something is happening and emerging, the sooner we can alert the world by sharing through those collaborative resources, and the sooner we can trigger the private sector and the scientists around the world to get a head start on making diagnostics and drugs and vaccines. Collaborating with organizations like CEPI, for example, sharing that information, early evolution of a new pathogen, so CEPI and its partners can trigger early development of vaccines, and governments who don't traditionally move as fast as the private sector or philanthropic organizations, but we're doing it in collaboration with governments so that the private sector and the philanthropic sector can seed those efforts, get a head start, and then allow the governments to take over and really fund those and accelerate those efforts where they're needed around the world. That is how we envision collaboration and sharing data in our institute with other partners around the world.
Thank you. Thanks, Rick. And Monica, let me come to you. What you're all doing, by the way, is you're answering the difficult questions, and you're giving me some of the answers as part of that. So thank you. Monica, I mean, to the private sector, the obvious difficult question has been, what has driven the investment? Has it been driven by profit motive? Why were certainly some of the private sector role players, the pharmaceutical industry, slow to embrace COVAX and to come to the COVAX facility? And the whole issue of intellectual property, given that there are clauses in the WTO that would allow intellectual property to be relaxed in the context of a pandemic. Has the private sector taken stock? Will it behave differently in future? Will it, in the future pandemic, behave more openly, for example, with products for COVAX and so on? What do you say?
Thanks, Helen. And I was kind of expecting this question. So let me start this by saying that as much as we are congratulating private sector for bringing this, innovative therapies and vaccines in record time, let me just reinforce the fact that it is because of the existing IP framework's capacity that we've been able to foster healthcare innovation through investment and collaboration. And that has been the key to rapid development. And it has not been a barrier to access to COVID-19 tools as well. On the contrary, it is what we will incentivize the companies to produce more medicines. And it's important because these IP frameworks also help us in fostering collaboration for the rapid development as well. And you could look at many examples for COVID-19 as well, how Pfizer and BioNTech, they collaborated. Roche per se, we have collaborated with Regeneron to come up with antibody cocktail. AstraZeneca worked with University of Oxford in partnership, committed to sell for non-for-profit. So per se, what I want to focus here is that talking about IP waiver is not going to solve the COVID-19 inequity. And I also say this, as Dr. Tedros has also addressed in the WHO Executive Board meeting this week, that there is now enough supply. Problem for the vaccines is now on the last mile reach. And IP system did not come in the way of sharing virus sequencing information, nor even in the way of vaccines development or in the way of upscaling manufacturing capacity. It's been export restrictions, imposed tariffs, vaccine nationalism, lack of absorptive capacity in developing countries, and logistics in vaccines rollout campaigns, vaccines hesitancy. I can go on, short shelf life of donation. These all have been bigger barriers than this. And just to let you know, if we talk about pricing here, I can't talk on behalf of other companies. I can acknowledge the fact that pricing has been a concern, but at Roche, at least what we've been cognizant of, how do we price responsibly? And the reason is that we focus a lot on patient benefit and the impact a medicine can bring for the healthcare system as well and society. And that the profit that you've just mentioned, I would call it the investment. It allows us to invest year after year into high risk and complex areas of medicines, meeting the needs of patients, not just for today, for tomorrow. So I think all it requires, and especially now that we are discussing of an impending pandemic treaty as well, it's all the more pertinent that as we understand that, we need it, but at the same time, the negotiations would require input from all stakeholders, and that input should also come from private sector, from the non-state actors as well, and also from, member state companies as well. And that's when we can think of building back better together a resilient health systems, and not just looking at, some of the challenges, which could be IP and pricing in some cases, but actually the systemic challenges across the, value chain of healthcare in terms of delivering and making those vaccines and therapeutics available and accessible for all. Thank you.
Thank you. And I was hoping to come back, but I see the hour has whizzed by, but you've given me quite a lot in what you've already said. So let me try and pull together, I think, some of what you're recommending for the way forward. That is this idea of pandemic treaty or an instrument is really gaining momentum. It's going to be difficult to get countries all to buy in, but I think there is a sort of talking, and you've mentioned between all of you some of the rules, the playbook, as Sumia said, and that includes WHO's leadership. Really looking at that and really looking at the tools that WHO has, and looking at how do we sustain and support WHO in that framework. It also requires us to look at what we've learned about COVAX and the ACT Accelerator. From the regional point of view, I think what we've seen is extraordinary leadership, and that has to continue. Extraordinary leadership from the African Union and the African CDC. But we're doing it on the back of a weak infrastructure. So what we can't do is get excited during a pandemic. We now have to build that resilience. You mentioned surveillance, health systems, absorptive capacity, human resources, which we lose month on month from this region, manufacturing, and that some of that is already happening, and we need to sustain that. From the point of view of Rockefeller and the big data, I think that this is part of this agreement. And you said we need to have agreement on sharing on data sharing. The principles need to be agreed, and it's big data as well as the small data, and it's all the partners. It's the private sector, the scientific community, it's member states, it's philanthropy, and it's public-private partnerships. But it's also technology, as you mentioned, Rick. It's not just saying, you know, one size fits all, we've got the tools. It's actually pushing ahead with that technology. But I think you made a very strong case about early alert equals data sharing and tackling some of those geopolitical barriers. And finally, with the private sector, you know, I think the issue of IP will continue. Yes, it will, and it's a healthy debate. But public-private partnerships at their best in this have been, as you've outlined, extremely important. The private sector does have the tools to do this, but where it has partnered with academic institutions, amongst others, we have seen this very rapid acceleration. And I think that we've also said, going back to the beginning, that a pandemic treaty would have to include the private sector. And there would need to be sort of questions about private sector engagement in COVAX, in the ACT Accelerator, tiered pricing, all of those things would need to be part of those negotiations. And overall, one thing in the chat we didn't get to, but I just think it's really important, is the importance of media and trust and communication to people, because we've seen that lack of trust in science because of our communication challenges. Tim, over to you for closure.
Great. Well, thank you very much. Helen, once again, you've done an extraordinary job packing 3 hours of conversation into a single hour. I have a sense we could be going all day here. But really, I want to just thank everyone for contributing to this session. Helen, good moderating, to Sumya, Taj, Rick, and Monica. I hope we get back together again, maybe perhaps next year, to review where we are. But thank you for a really rewarding session. Thank you all for your great contributions to PMAC 2022, and we look forward to working together this next year and PMAC 2023. Thank you all.